My name is Nikki and I am doing the Module 3 blog. I work under the model of nursing where the patient care is the responsibility of the nurse. The primary care happens between the nurse and the patient, and although the nurse does work with other disciplines, I am a psych nurse, so we work with several disciplines cohesively, and without those disciplines we would not be able to effectively treat our patients. Some of the disciplines we work with are social workers, our outpatient mental health providers are very important because often our patients are coming from them and will return back into their care. Therapists, the psychiatrists, which will manage all psychiatric medications, and then they have also a medical doctor for any medical conditions they may have. We work closely with family nurse practitioners and pharmacology because a lot of our patients are on multiple psychiatric meds as well as medical medications. Working together can be complicated and confusing for a lot of people, and it's important to have an open communication where everybody is aware of their roles and the impact that their roles will have on the quality of care for the patient. So good communication is imperative. In the article that I have referenced attached, it makes note that the National Joint Practice Commission recognized the detrimental effects of nurse and physician conflict on patient care. So if there is conflict, it can have a negative impact on the patient's care. To avoid this, there has to be a clear understanding of each other's roles. But by using multiple disciplines in patient care, different perspectives and knowledge are used for a more holistic approach, which will be able to consider all disciplines and hopefully impact the patient in a more positive manner. So with that, there has to be the respect for each discipline and what they can bring to the table. Historically, physicians have seen themselves as the primary decision maker, and so this is gradually changing. In my department, we rely heavily, or the psychiatrist relies heavily on the nurse's input because a lot of what we are dealing with is patient behaviors or their reactions to their medications that the psychiatrist has prescribed for them, such as depression or psychosis, substance abuse treatment. So we're with the patients for the majority of the day, so the doctors really rely on the behavioral aspects. The article I attached also states that the interprofessional collaboration prevents fragmentation and increases the effectiveness of healthcare delivery. So if all the disciplines are working together, it's a more cohesive plan of care. The subsystems I also work with, the ones I've mentioned before, are the pharmacy. We work closely with security also, as safety is key on our unit. The house manager, house supervisor, if there's any questions that our NUS is not aware of, they will often contact the house supervisor. And then, like I mentioned before, the therapists, the social workers, our outpatient providers, pharmacy, psychiatrists, medical doctors. And oftentimes in my discipline, the psychiatrist is strictly going to stick with the psychiatric condition, and then the medical doctors will strictly work with the medical condition, and then pharmacy can oversee the medication management. As the manager, I would also work